Hello, everyone. It's 2 o'clock. We're going to wait a few seconds to get started, but I wanted to welcome you and let you know that we will be starting soon. Okay, as we'll get started, I know there's a third panelist who is to join us. Might be coming on right now, but to welcome you all. I'm Paz Ardasa Regan. I'm the program manager at Catholic Climate Covenant. And I hope that today you're all here for today's conversation, Faithful Recovery in a Time of Climate Change. And as you know, every time that we do one of these, I give you what we call the housekeeping rules. A lot of folks might say that they're having audio issues. If you are not hearing very well, consider switching from your computer audio to your phone audio. And to do that, you go to that little box that says audio, click on it, and it'll give you the instructions of how to call in with your phone to use that as your audio. The webinar is being recorded, and you're going to get it within the next 48 hours. And if you can submit your questions and any comments in the question box, and if you know which panelist it's for, that would be very helpful. We always begin with prayer, and today's no exception. So I ask you to join me and to center ourselves and remember that we are always in God's presence. And join me within this prayer that is from Catherine Gorman from KFOD. In the name of the Father, the Son, and the Holy Spirit. Amen. We cry out to you, God of all. We cry out to you for help. In your mercy, hear our prayer. Protect us, Lord, and be with us, especially those of us most vulnerable during this coronavirus crisis. Move us to reach out in love to our neighbors near and far, so that the humble may be exalted, the hungry filled with good things. Grant us the courage not to rush back to our old ways, but to rebuild our world together, creating foundations of justice with equality and peace for all. Amen. In the name of the Father, Son, Holy Spirit. I want to welcome you today. We're joined by 3 panelists. And before I introduce the panelists, I want to give a little bit of a framework of what this webinar will be about. Today we're going to examine the many crises that we're facing, that some of them that seem insurmountable. We're facing a global pandemic, mass unemployment, and economic uncertainty, hurricanes that are hitting some of our coastal communities, on top of already known flooding in many of these communities, droughts, wildfires, and all of this happening with the underlying context of systemic racism. That means that our most vulnerable brothers and sisters, our most vulnerable brothers and sisters and neighbors continue to be disproportionately impacted by each one of these threats. Some policymakers and activists have latched onto the idea of just recovery, or making sure that we build back from COVID-19 and the economic and social fallout in a better, more just, and more sustainable manner. Some advocate for us to apply a climate lens to the economic stimulus and recovery plans that create jobs and in a clean energy economy, that reduce carbon emissions, toxic pollutants, that would ensure clean air and clean water, and increase our collective resilience to future shocks through increased access to affordable housing, quality health care, healthy food. For the faith community, we are calling this kind of a framework faithful recovery. So in today's webinar, we're going to focus on the concept of faithful recovery by hearing from Catholic organizations that are working at the front line of how we are responding to the economic, social, and environmental upheavals we are currently experiencing. We're going to hear from Kim Burgo of Catholic Charities and Marilyn Shapley of Catholic Relief Services about what they are seeing on the ground and how their organizations are responding. We'll also hear from Ricardo Simmons of the USCCB about what Catholic guiding principles we can hold on as we debate the many policy issues and proposals that will be coming up. And as we recover from this pandemic, from the economic and social crisis in the midst of all climate change. So at this time, I want to introduce you to Kim Burgo, who will be our first speaker. Kim is currently the Vice President of the National Disaster Operations Office for Catholic Charities USA, which is based in Alexandria, Virginia. Kim has participated and or led social service-based response and recovery program in 25 countries, as well as in the US and US territories. Her current disaster work addresses the many aspects of human vulnerability, suffering, and poverty, while seeking to implement long-term sustainable solutions at the national, regional, and individual level. She's been with Catholic Charities since 2006, where her work has spanned responding to 450 disasters throughout the US. She completed a fellowship at Louisiana State University in disaster management and attended the College of Notre Dame in Baltimore with a focus on religious studies. Kim, if at this point you may take the lead and just let me know when to change the slides.
Great, thank you so much, Paz, for allowing me to be here. Yes, I'm with Catholic Charities USA, and we remain very busy, not just in COVID-19, but in disasters as well, and we'll talk about that as we go along. Can you switch the slide, please? So I think it's important to note that that it's not just us, but around the world. If you haven't heard this before, you should really take it to heart that COVID-19 is a disaster that affects everyone. It is the only disaster that I've heard of that where every person on the earth, every person in every country around the world is now a disaster survivor. That has never happened before. And I think that's really important because there are certain emotional, physical things that happen to people that we are all going to go through at some point in time. And sometimes that can be confusing on how to react. For instance, disasters usually happen in one place. The media attention goes to one place. People come from outside that place to come in and help and assist. They send resources to that place that's ground zero. Volunteers come out of nowhere, resources start flowing. But you know what? COVID-19 has kind of said to us, what do we do in this? You know, where is that one place? Is it Texas now and New York City before and California, or is it Italy, or is it somewhere else? So it's become very confusing when all of us are disaster survivors at the same time. Next. I think as Paz mentioned, yeah, there are some certain things that are affecting us all right now, and how this COVID-19 has really changed us. The social aspect, the economic aspect, and of course the environmental one. If we just start with the social one, our offices are now our homes. Many of us are working from home. Our worship spaces are now online. I've never watched church before on TV, and now it's become a regular. The stores we shop in are to go. We just pull up and people put things in our car. Instacart is no longer a luxury. It's become a reality and a necessity to many people. As restaurants have opened up, all of a sudden we're eating in parking lots under tents. And what used to be illegal to walk around with a mask and sunglasses is now a must. Everybody walks around with masks and sunglasses. But as we move on to the economic, we can certainly see that we have to use our homes now. Because of our workplace has become our home, we have to use our homes, and we share our space in our cubicle with now our kids and our um, we share the workspace with our kids and our pets. We don't have a commute time. It's very hard to distinguish between what's home and what's not home. We seem to work more hours. Doctor's appointments are now online. If you actually go into a doctor's office, you're usually screened 3 or 4 times before you're allowed to sit somewhere or be somewhere. And all your medical forms are all PDF. So if you're not computer savvy, then it becomes a real challenge. I started to say economically, there's many stimulus packets now that are coming to an end. This has brought on great fear, especially in the area of evictions. I recently heard a study that said that in New York City alone, in order to help to prevent an eviction crisis, just to keep it at bay, that New York City alone needs $356 million a month just to be able to keep it at bay. That's a lot. It's really interesting too, as places are deferring payments. I think it's great that companies are reaching out and deferring payments, but I should say that they're not forgiving payments. So they're just deferred. So at the end of the day, a person who has a monthly payment might have a little bit higher monthly payment, which may be difficult to also keep because they won't have a higher pay. As we move into the environmental piece, I think that is a very bittersweet piece. I have noted that NASA is closely monitoring all that's going on with COVID-19 environmentally. And I think that we can quickly see there are less planes flying in the air. There's less toxic emissions. You can see videos and pictures of the before and after of COVID-19, where a notable site in the world will show what it was like when everybody was commuting to work versus the clearer skies that we now have because everybody's at home. But I think that we also have to remember that natural disaster events are also prevalent and that they are stronger than ever before. And because of climate change, this does cause a problem. So when you add COVID-19 to that mix, it becomes a dangerous mix. And just to give you a very real life last week example is Hurricane Hannah that hit the Rio Grande Valley. So the Rio Grande Valley, if you watch on television, any major news story tells you that their hospitals are filled. They are sending those who are going to die home just so that they can have beds. And the Rio Grande Valley hosts a large number of folks who are immigrant families, and many of them have been living in tents. And so within the immigrant population, there are large numbers of COVID cases. So you take all that and then you add a hurricane to it, where you have to evacuate to another place. Now you're spreading it. Now you're passing it along. And it just, climate change and the impact of those disasters is going to impact COVID-19. Next slide, please. So it's very funny. Always in the disaster world, I hear people say, "Well, I don't know what's going on," and you know, it's always a challenge. I'm not getting great information and everything else. And I think it's really important to know that if it were clear and concise and organized, it really wouldn't be called a disaster. Disasters, by their nature, are meant to be chaotic. And I think that COVID-19 and any natural disaster that comes is going to fit this description. So it's just good to know that that's always going to be there as long as it's a disaster. Next slide, please. I also think it's important to know that because of climate change, that disasters have been stronger, and they've been a multiplicity of disasters at the same time. Um, Most disasters do have a secondary disaster. If we look at the last 10 or 15 years, you've got Hurricane Katrina that was immediately followed by Hurricane Rita. You have Hurricane Gustav, then next was Hurricane Ike. You had Hurricane Sandy that was a superstorm on the front end, but on the back end, it was a blizzard. Who's ever heard of that? That's really, really crazy. You had Hurricane Florence and Matthew, and of course in 2017, you had Hurricane Harvey, Hurricane Irma, Hurricane Maria, and all the wildfires in California in a span of 6 weeks. That was unprecedented. Now we have COVID-19 and any other natural disaster that comes this way. Next slide, please. So I do want to point out how this is going to work. You know, how does this work when you have COVID-19 and a natural disaster? So FEMA, you'll see up there in the first little block, has changed their guidance. They are going to be more virtual, and they're going to be following a lot of CDC guidelines on what to do. That means a lot of social distancing needs to happen. All right, well, we all understand that. We've all been practicing social distancing and wearing masks and following guidance, but how does that really play out? What's going to really happen when people need to evacuate? Let's just take that little picture of a bus where people are all wearing masks. So this means that now if you're going to social distance and you're going to follow CDC guidelines, that bus that usually evacuates 66 people at a time is now only going to evacuate 25. So what do? You're going to need more buses. You're going to need more drivers. You're going to need more time to evacuate boats. Also, it's important to know that there's not going to be any FEMA-supported congregate care. That means shelters are not going to be available. And if there is a shelter, again, the number of people you can keep in that shelter is minimal. I had a phone call this morning in the Virgin Islands who right now is having a storm, tropical storm Isaias, and they were saying to me that because CDC guidelines kick in, that they can only shelter 8 people, which is just a quarter of what they would be able to shelter otherwise. So a lot of sheltering is going to happen in a hotel, but that's a problem because many places, many people who need sheltering may have pets that come with them, but hotels say no pets allowed. So what do? If you do find a shelter, now you need the extra staff to provide for that shelter, which a lot of times, even with the Red Cross and other places, they do rely on volunteers, but volunteers aren't coming out. You know, volunteers are also affected people. And I think one of the hardest things is that FEMA will not necessarily have a disaster recovery center where people can go to and actually file their application at the time of a disaster. And they're really working to have things be online. So what are you supposed to do if you have to evacuate, you have no access to the internet, you lost your power, but you got to get your FEMA application in, and you don't know anything because now you're in maybe another city and grandma doesn't have internet access and it's still maybe dial up, whatever it may be, it causes a lot more confusion. So we are anticipating much more information confusion to happen when there's a disaster, and looking at ways to confront a lot of these challenges. Next slide, please. I don't think that anybody is surprised by this, that disasters will always disproportionately affect the poor and vulnerable. But here in the United States, the work of Catholic Charities has become more important now than ever before. I really do see that recent societal topics, as Paz was talking about, such as housing shortages, unemployment, racial disparities, pandemics, has taken that daily conversation and is now transforming once stable families and individuals to now becoming part of that growing vulnerable population. And it's not stopping. Next slide, please. But I'm sure you can guess, Catholic Charities didn't shut down its services because there was a pandemic. It certainly made it harder for us. We're not physicians, so obtaining masks was very, very difficult. Any kind of PPE kept me up day and night to try and protect our staff. As a matter of fact, I think the services intensified. Agencies quickly had to switch to new programs and learn how to operate them differently. They had to put in protocols and guidelines for their own staff who may have become ill. Do they have to shut down? Do they have to report to the CDC? What is it that they had to do in their own communities? Most agencies have cited a 30 to 50% increase in their provision of services, but a couple have cited as high as a 400% increase in social services that they've needed to provide. And, just like any other disaster, people are coming to our place and seeking services who have never ever sought social services before. So they're confused and they don't quite know what to do. Next slide, please. So here's just an overview. I want to be conscientious of my two colleagues who are also ready to present. So this is just an overview of the kinds of things that our Catholic Charities agencies on the ground are providing. That is on your left side, and on the right is what we at Catholic Charities USA are doing to support our member agencies. I think it's important to note that we have been gratefully blessed to be able to support our local agencies over the last 4 months with about $7 million to help keep their staff on, to help keep their programs going, to help really keep the lights on and just keep plugging along. But what's more astounding is that local agencies themselves, on top of all the stimulus packages that have been offered, have provided right now to date about $350 million to clients coming in the door. And that's just an astronomical amount. Next slide. So I'm just going to close there, but I do want folks to note that web page down at the bottom. That web page is a page that we created for workers, for agencies, for anybody that needs assistance or information on what to do in mental health, what to do if you have a shelter, what to do if you have to feed, what to do with the school, all these different information components. You are welcome to access this site. We've kept it away from the public and only handed out to people and agencies that we feel would benefit from it. So I encourage you to go on and explore, look at the different resources. We do change the resources almost every day. Anything that's new comes on, we put webinars on there, we put information on there, and there's a way to contact us on there if you need a specific resource or have a question. So thank you very much, and I'll turn it back to you, Paz.
Thank you, ma'am. Kim, we are now going to sort of switch the view from a U.S. perspective to more of an international one. Marilyn Chapley will be presenting from Catholic Relief Services. And she is a senior policy and legislative specialist with CRS, part of a small team based in DC that focuses on policy and advocacy recommendations relating to global hunger and climate change, as well as regional issues in East and West Africa. Before, she has worked with Mercy Corps, Interaction, the Alliance for Peace Building, and in the office of Representative Dennis Cardoza. She has a master's in international relations from Johns Hopkins and a BA in international studies from UC San Diego. Marilyn, it's all yours.
Thanks, Paz. And for those of you who might not be familiar with CRS, we carry out the commitment of the U.S. Catholic bishops and the Catholic community to assist the poor and vulnerable around the world. We currently have programs in more than 100 countries. We serve a population of about 130 million people. And we've been doing this since 1943. So really excited to share the work that we do, but as you've heard from Kim, and as I'm sure you all know in your personal lives, this has been a really hard year. COVID-19 is hitting the people that we serve really hard. Currently, globally, we have more than 17 million COVID-19 cases, and we're working with our partners to respond to the risks and the impacts that we see in the most vulnerable communities. And those are in places like Latin America and the Caribbean, or in Africa, where we're seeing the case numbers rise, and the peak of the pandemic hasn't hit yet. That's still coming up. It's expected to come in 2 to 6 months. What we are seeing, though, is really troubling projections about the negative impact, and a lot of them are that secondary disaster that Kim referenced in her presentation, looking at an additional 70 to 100 million people pushed into poverty, looking at 80 to 130 million more people going hungry, and that's an emergency hunger level. Primarily, the ones that are most at risk are the ones who are already impacted. So those are internally displaced people, refugees who have fled conflict, people who have been displaced by flooding. A lot of people in East Africa and South Asia have been impacted by desert locusts this year already. They don't have a lot of ability to cope to begin with, and this pandemic has pushed them over. Next slide, please. So we're at this pivotal moment, and we do have to choose how to respond to the needs of the most vulnerable right now as a church, as a global community, because it does make the difference between life and death. It is that difference between 70 million or 100 million more people in poverty. It's the difference between 80 million versus 130 million more in need of emergency food assistance this year. So CRS has 3 priorities. This first one, as you can see pictured here, is partnering with our local health systems and trying to help strengthen them. Just like here in the United States, our hospitals, those that we work with closely, they needed to prepare, they needed to respond. And what you can see here is an example of what that looked like. So for some, it was passing on the right type of knowledge. You can see here a training that was done with about 3,000 healthcare workers in Kenya. There's follow-on trainings now being planned in terms of how they can safely provide services. You can also see pictured here a distribution of critical supplies within Ethiopia to our CRS partners, Catholic hospitals and missionaries of charity throughout Ethiopia. We're also hoping in that same country to set up 16 isolation tents, something that's very needed. Next slide, please. So that gets us to the second priority that CRS has had for responding to COVID-19 immediately, and that is to prevent the spread of COVID-19 through awareness raising, and especially through good WASH practices. And WASH stands for water, sanitation, and hygiene. So what you see pictured here is an example of both. On the public health information side, this is a young girl who's currently in a CRS school in Afghanistan. So she does know how to read, but you can also see here pictures as an example for those who are illiterate still in the community, so that they can actually trust the information that's coming to them. If you imagine yourself being in an isolated rural community, water is already scarce, soap is considered a luxury, and it is really difficult to find reliable public health information about what social distancing is, why it's important, why do you need to wash your hands, how does COVID-19 actually spread. So that's what this type of information is to do. You can also see an example of a young child in Ghana who's using something that we call a tippy tap. This is a jerry can. It gets rigged up so that people can wash their hands using soap in a more hygienic way than what you would normally do. It helps prevent the spread because there's less touching on things. And we do a lot of this work to spread this message, to make sure these kits are accessible to communities in partnership with local governments, with faith and community leaders, because we can't do this alone. We have to work through these existing systems as well and help strengthen them up so that they can continue to be prepared for the next disaster that will inevitably come along. Next slide. And we're also working in these fragile communities. I think that Kim touched really well on how hard it is to socially distance when you have people that are in camps or have evacuated homes because of flooding. And we've seen that in Bangladesh this year. So we've been working with the Rohingya population. They've been living in a tightly spaced camp. And to prepare for COVID-19 before the disease was ever recorded in the camp, CRS worked with Charities Bangladesh to build 175 midterm shelters so that there could be an opportunity for quarantining, for social distancing, because you had a lot of families packed in very tightly. And if someone had gotten sick, that just wouldn't have been an option. Quarantine was not going to be an option without these shelters created. We also have seen cyclones hit Bangladesh this year, and flooding has forced people to make the terrible decision of either staying or risking getting COVID-19 in an evacuation shelter. So we did work really closely with Caritas as well as the local government and other leaders so that they would understand what precautions needed to get taken, similar to what Kim was talking about. And we've been doing that not just in Bangladesh, but also places like Mali, where people are getting displaced because of conflict. The same types of practices need to be conveyed to our local partners so that they know how to limit the risk as much as possible as people are fleeing. Next slide. And a lot of that is a primary impact, but we are also looking at the secondary impacts and how to help those who are facing issues like hunger or needing to continue their livelihoods right now. So CRS is focusing on providing relief, and that means that we are trying to help communities who, just like in the United States, got hit by lockdowns and movement restrictions. They couldn't continue to make a living. And hunger was the first impact that a lot of them have experienced. So CRS worked hard to get permission to continue to provide the emergency food that we were already giving. You can see that with the picture here and the food distribution in Ethiopia. We actually did what we call a double distribution. So we increased the amount of food that people got. That way they knew that they could stay home for that longer period of time safely without needing to go out and find additional food. What you see here pictured in Mali is a different type of food assistance that we've done. So it was also providing household kits. And this is a good example of a distribution where we were taking precautions and doing things differently than we had before. Not only were we, as you can see here, providing hand sanitizer for people and practicing distancing, providing masks, but there was also a temperature check and a separate health place for people to be referred to who had symptoms so that they could get treated for their health conditions alongside the food needs that they had. And then finally, for those of you who might be familiar with the young woman pictured here in Guatemala, this is Maria Ana. She was actually featured in Rice Bowl this year. She's a student in Honduras, and her school has been closed because of COVID-19. And like the 1.5 billion students who are currently out of school right now, for a lot of those students, her only meal has been the one that the school was providing. And these are programs that are similar to what we fund through the United States Generosity. So this is the McGovern-Dole Food for Education program. And we're happy to report that we have been able to work with the local government, work with the school, and work with PTAs and others to be able to continue these distributions so that the children are still able to get their meals. What we were able to do here in Honduras, similar to what we've done in Guatemala, was work with the PTA to make sure that the food that would have been provided at the school was distributed into kits. Those kits were then pushed out by the PTA. I can follow up with pause afterwards, there's a great picture of social distancing marked by hula hoops out in a school playground. And we worked specifically with the local suppliers for that food so that we could continue to have nutritious products as part of that meal kit. So that's access to fruits and vegetables, and that's access to additional protein like eggs. And those are things that a lot of families can't afford normally, especially right now. Those prices are going up and making it difficult for families. So even if they were maintaining their calories, the nutrition quality was decreasing, and this helps prevent or mitigate some of that impact. Next slide. So right now, CRS is asking Congress for an emergency supplemental funding. We're asking for Congress to provide at least $20 billion to prevent, prepare, and respond to COVID-19 overseas. Congress in the first and third stimulus packages was able to provide about $1.6 billion. All of that has been distributed now. It went across 120 countries, and we appreciate that generosity, but it's not enough. And we do have to act right now. It is our moral responsibility to do everything we can. It is the difference, as I said, between that 80 million people who are going to be in additional poverty versus that 100 million. And that's a big difference. So a lot of people want to know, well, why can't we wait? We can't wait because the soonest we might get additional foreign assistance funding is at the end of December. And that's tens of millions of people whose lives are going to be impacted. Next slide, please. And that also gets me to this point about climate change. A lot of people want to know, why do we need to work on climate change right now while we are in the middle of a pandemic? Not a lot of people think of the environment as the first thing to respond to or wrap into a programming when you're in the middle of a health emergency. And for CRS, this has actually been, a terrible reminder that your health, your economic well-being, they can't be sort of independently split off. We use a model for development. It's called integral human development. This is holistic. We are all one body. You can't just provide health without a living and expect someone to be okay. And similarly, you can't holistically respond to someone's needs without also caring for creation. It is intertwined with needing to help those who are poor and vulnerable. We've also seen that the people who are most impacted by COVID-19 were the ones who were already being impacted by climate change, and that was with social, economic, and health impacts. It's also things like inadequate access to clean water and sanitation, overcrowded shelters, food insecurity, and insecure livelihoods. And just like with the coronavirus, climate change is a great equalizer. It does impact all of us. So we have already, as CRS, been working to provide adaptation to communities that we partner with. That has been through climate smart agriculture, which you see pictured here in Malawi or Central America. That's also been working to provide disastrous reduction strategies and better shelters, making sure that we're helping the displaced, helping communities learn how to save or diversify their income so that when a drought hits, they have other access to money. And CRS, since Laudato Si has been introduced, has taken a public stand on climate change. I think most recently, our Lead the Way on Hunger campaign is a great example. It was launched during Laudato Si Week this year, and that was through a week of action, both for prayer and other actions. So we invite you to join us in this Lead the Way on Hunger campaign. Next slide, please. We have two versions. One is Lead the Way on Hunger. The other one is Lead the Way on Migration. Both actually do have climate change components wrapped into them. And this is an opportunity to learn how to advocate with CRS to provide for the needs of the migrants, refugees, children, and families struggling to meet their basic needs. Next slide, please. So as I said, we do invite you to join us in this. There's two ways that you can see here to do that. The first is by visiting crs.org Lead the Way, and you can see sort of links below to the two different campaigns, both Lead the Way on Hunger and Lead the Way on Migration. Or you can text LEAD NOW to 306-44. And if you do text, what you'll be added to is an action alert text message service so that you can get up-to-date information on campaigns that Catholic Relief Services is doing so that you can take tangible action and advocate for these communities that we serve and care about together. And as I said, this type of action is more important now than it has been ever before. So we hope that you will join us, and I thank you for your time. Look forward to questions.
Thank you, Marilyn. Wow, both you and Kim have really given us the view of what the church is doing, how you're responding to the needs, the frontline needs. We're going to switch again, and this time we're going to ask Ricardo to present. Ricardo is with the U.S. Conference of Catholic Bishops. We asked him to really look at the principles, the guiding principles that the church needs to take when looking at policy and actions that will be coming forward in the next few months to next year. So let me introduce Ricardo. He is a professional consultant and expert on integral ecology, and he focuses on the intersection of climate science, environmental policy, philosophy, and theology. He represents the U.S. Conference of Catholic Bishops on Climate and Environmental Policy. He is founder of Creatio, an environmental nonprofit based in Colorado that integrates ecology and service to the poor in thought, prayer, and action. He's a PhD candidate in environmental studies at Colorado Boulder. He received a Master of Science degree from CU Boulder with a focus on climate science, policy, and philosophy. He was born and raised in Sao Paulo, Brazil. He acquired his love for nature while surfing off the north shore of Sao Paulo. I've never been there. I wish to go someday, so I now know who to ask. Ricardo, you may start your presentation.
Thank you, Paz, for the introduction, and also Marilyn and Kim for your great presentations. Yeah, surfing on the coast of Brazil sounds really good right now in the middle of a pandemic. I want to talk about the principles for a just recovery, and it's great that we just had these two presentations which put a face on what these principles look like. Principles look like something in reality, and we just saw that through Catholic Charities and CRS. The image I put here on the PowerPoint, I don't know if you look closely, if you can recognize what passage that is in the Gospels, but I was trying to think what is a good symbol for what we're going through right now. And this is an image of Lazarus, who's receiving his life back from Jesus. And this is very much captures what I think we're going through in many ways. One of them is, as the Gospels say, the body was rotting, there was death there already. And I think this pandemic has shown the fractures and the weakness in so many of our structures. And often it's the poor who pay the price. And that's what we're seeing everywhere. And that is very much the message of Laudato Si in the environment. And it plays out as we see in the pandemic. And also there's another dimension. The Eastern Church really has a high reverence for this passage of Lazarus and his life being given back. They even celebrate Lazarus Saturday, a week before Holy Week. And for one, it reminds us of how much faith in God and hope we should have for us to recover from this and build a more faithful and better world, but also the humanity of Jesus, who weeps for his friend. And this situation requires tremendous amount of humanity and concrete material help, which again, we've seen through the witness of Catholic Charities and CRS and so many other brothers and sisters who don't share faith, who have done so much good for so many people in need. Next slide, please. So talking about principles, I want to start with Pope Francis and this chilling image during the Urbi et Orbi message in Rome that really captivated the whole world. And Pope Francis has connected the environment to the pandemic and the theme of recovery in many situations. During this message in Rome on March 27th, he says, "We have not listened to the cry of the poor or of our ailing planet and assumed that we could stay healthy when our home is ill." Again, bring in that theme that there were already underlying problems. And as Laudato Si says, everything is connected, and the pandemic has revealed those. Later, in April 8th, he gave an interview that was published in Commonweal magazine, addressed to the English-speaking world, so addressed to us. And he said the following: "Today, I believe we have to slow down our rate of production and consumption and learn to understand and contemplate the natural world. We need to reconnect with our real surroundings. This is the opportunity for conversion." Again, seeing this pandemic as an opportunity for change. So many things need to change, and they have needed to change for a long time. This is a chance for us to address them. And finally, during the high point of the pandemic in April, was Earth Day. And Pope Francis didn't shy away from the environmental message, and in fact connected it again to the pandemic. He talked about the importance of harmony and how we need to look to the Holy Spirit to build that harmony. He also called for an increase in international solidarity in caring for our common home, as well as for subsidiarity, urging action at national and at the local level. He mentioned a call for ecological conversion, the importance of COP15 on biodiversity and COP26 on climate change, and emphasized that this is Easter season and this is time for renewal, and the time where the Holy Spirit can renew the face of the earth, quoting the psalm. And finally, on May 24th, he announced a special year for reflection on Laudato Si, inviting everyone to participate. Next slide, please. Now I just want to mention the USCCB's response during the pandemic at the principle and policy level. And really the common theme was looking at our most fragile brothers and sisters. And that's the foundation of the policy response. On March 12th, and you see in the picture there, the chairman of the domestic committee of the USCCB, Archbishop Coakley. On March 12th, he requested that special attention be given to the poor, the elderly, the homeless, the imprisoned, immigrants and refugees, and those with severe underlying health conditions. Again, those who are already affected are the poor and underprivileged who suffer the most from this. On April 9th, several chairmen wrote letters to congressional committees addressing the pandemic, promoting several principles in the service of the common good. Number one, dignity and value of all human life. Number two, protecting the poor and vulnerable people who are most at risk. Number three, promoting life and life-affirming policies. And number four, not advancing the destruction of innocent human life. And these principles played out in very specific requests to the government administration. One is encouraging and urging the development of a vaccine, but a vaccine that develop ethically and be free from any connection to the exploitation of abortion. There also was a specific request for increased food security measures, paid sick leave, adequate care for immigrants regardless of their status, and greater assistance for low-income workers, the unemployed, and those experiencing homelessness or housing instability. And finally, also a request for suspending work requirements related to programs like SNAP, the Supplemental Nutrition Assistance Program, and providing additional resources for emergency food and shelter programs. And on May 22nd, Archbishop Coakley called for additional research on the link between air pollution and coronavirus health outcomes. If you may remember, there have been a few preliminary studies making the link between health and air pollution and the impact of the coronavirus. And also another environmental connection that's important is the need to address disruptions in the food supply chain and its impact on farmers and farm workers, food waste and public health. Again, an example of how underlying weaknesses in the system with the food supply chain just became evident with the coronavirus. And there were different food industries that were affected, and very few distributors give all the food in the United States, the meat especially, we saw that. So there's weaknesses there. And finally, with regards to asks regarding the environment from the USCCB, one positive piece of news, and this passed, but the USCCB advocated on behalf of the Great American Outdoors Act, which is supported the public lands, and that was passed. It had bipartisan support and has been signed, I believe, last week. So a positive outcome there, and also for appropriations funding for the interior and the environment. Next slide, please. So very briefly, I'll just go over these principles. I've mentioned some of them, how they've played out in policy, but the first one, ensuring health for all people. And this requires understanding in the context of Laudato Si. If we can remember one quote from the encyclical is, exposure to atmospheric pollutant produces a broad spectrum of health hazards, especially for the poor, and cause millions of premature deaths. So there we go. Laudato Si was already talking about this, and this plays out in during the pandemic. And as I mentioned before, Archbishop Coakley called for a specific study on air pollution and the pandemic, which has been part of proposed legislation in Congress. Next slide, please. Ensuring food access for all people. And here's a picture of the bishops. This is pre-pandemic. That's why they don't have their masks on, but they are in rural in southern New Mexico. I had an opportunity to visit, and where the the chilies are produced. And but food is essential, as we saw in both international and domestic examples before. And Pope Francis asked, will we be able to act responsibly in the face of the hunger that so many suffer, knowing that there is food for everyone? And Archbishop Coakley also nationally repeated that. So access for people is essential, and a just recovery must include supporting systems of food production that are sustainable and capable of producing enough food for the entire human family and distributing them adequately. Next slide, please. Also, just recovery must include the international human family, and this was a point of emphasis in many of the messages, that the church extends beyond national borders. April 9th letter to the congressional committees on appropriations, the U.S. bishops called for international disaster assistance that targets the most vulnerable, such as refugees and the displaced, the elderly and the vulnerable children. And I also mentioned before the request for including migrants regardless of their status. Next slide, please. And finally, a care for God's creation, which shouldn't be forgotten during the pandemic. And as was mentioned before, I think Marilyn mentioned this, a fragmented way of thinking can't connect those, but in fact, everything is connected, and caring for the environment is caring for people, and planet go together. The Holy Father asked for, his vision of recovery came along with this question: will we as an international community take the necessary measures to curb the devastation of the environment, or we will continue to ignore the evidence? Because of the pandemic, the environmental problems don't go away, and they're connected, and we need to continue to keep addressing them. So it includes an environmental efforts. And this is not in a slide, but also there's, through the principle of subsidiarity, this touches on an important message of the church from John Paul II through Benedict II, Pope Francis, on environment, which is change of lifestyle. We all individually have a responsibility to live and walk more gently on this earth in our daily lives. And those changes of lifestyles become more evident now. So thank you very much for this presentation. I just want to conclude with one thought by Pope Francis, which was his message recently, maybe a month ago, on the Feast of St. Peter and Paul, where he was talking about how it bothers him sometimes that he hears so many people calling for a prophetic church. But what does real prophecy means? And he says, real prophecy means service. We don't need fast talkers who promise the impossible, but testimonies that the gospel is possible. Not speeches, but service. Do you want a prophetic church? Start serving and be silent. And that be silent in Spanish is cállate, which is more like shut up and serve. And those were very strong words by the Pope. And I think that the examples we've seen from CRS and from Catholic Charities and many dioceses, individual parishes, and Christian groups and associations that service, that witness is what really matters. That is what is prophetic, and it's encouraging to see so many of the examples of the love of God through their witness. So thank you very much.
Thank you, Ricardo. Thank you. I'm going to have a few minutes for questions. If people have questions, please write them in the question box. I've only got a couple right now. One of them, I think it's for Kim. What happens to people with medical issues when they get in a disaster? Especially now, what if it's somebody that has COVID and goes into one of the shelters?
Yeah, they're usually separated. So if they can't be in a hospital or a hospital location, they will be completely separated from everybody else. And, you know, everybody has been going through these checks. So if you go into a place, you have to have your temperature checked, and you hold your breath all the time to hope that you're not running a fever that day. But if your fever is up, you're not going to be allowed in, and you'll be kept aside. If it is an emergency situation and you need to be sheltered, you will be sheltered very separately from everybody else.
Okay, and I got a question that is clarifying to the first one. The medical issue might not necessarily be COVID, but something else, and how would that be dealt with?
So I can tell you from experience, my daughter is a person that has medical issues, and one of her, she has an autoimmune deficiency, and she became sick just a few weeks back. And because of her autoimmune deficiency, they took her into the emergency room, they treated her, and they made her go home. So they're trying to, they will treat you in a medical facility and send you home. If it's something that can wait, they would rather that you don't go to the hospital. You have to call ahead to hospitals ahead of time if you have a medical issue, or even explain to an ambulance services they're coming to pick you up to do that. But also, if you, I'm sure people know by now, if you go to a hospital and need medical attention, then you will not be able to bring somebody with you. And this goes even if it's a disaster. So you get evacuated, you became hurt during the disaster, let's say a tornado or hurricane has left you incapacitated in some way, you will be brought to the hospital for treatment, but you will not, you'd be completely isolated. Just keep everybody separate.
Thank you. I think this is a question for Kim and Marilyn. How has the pandemic affected private donations to groups like Catholic Charities and CRS?
Marilyn can go first. I've been talking.
I appreciate that. I know that there's a lot of concern given how impacted people in the United States who are private donation donors have been in terms of their lives and livelihoods this year. We are always going to need more. And I'll just put that out there. There's never enough to help all of the people that we need to reach. But thankfully, Catholic Relief Services has been able to maintain our programs. And so while, yes, please give if you are able, we have not seen a reduction in terms of our footprint right now, which is good. We're very lucky.
Yeah.
Yeah, and I would echo exactly what Marilyn is saying as well, is that there's always a need. As the needs rise at the local level, then certainly more donations are required. And thankfully, though, we have not had to reduce any programming or programming staff to date, and continue to be very grateful for those that have been faithful to Catholic Charities.
Thank you. This was for Ricardo. Were the proposals presented to Congress well received by them relative to the moral responsibility we have to care for the poor and most vulnerable amongst us?
Well, some of the the responses were received, and actually some of the things are playing out right now. I won't get into the details of the different proposals from the House and the Senate, but certainly there's an awareness that there's tremendous need right now, and we're coming to a deadline. I believe it was this week where some of the provisions in the first COVID package were left. So the timeline is very short, and Congress needs to act. But the requests were very broad and wide. And again, unfortunately, the environment was left out actually from both the House and the Senate for the most part. And again, it shows a lack of awareness of the integral ecology and how everything is connected. We can't forget about that during this time.
It is 3 o'clock, and because I always tell folks I try to stay within the hour, there are a few questions that we didn't get to. I will try to answer them offline, and if I can't do them myself, I will ask the panelists to help me. But at this time, I do want to thank Kim, Marilyn, and Ricardo. Thank you for being with us today, for giving of your time, your expertise especially. I think that everybody in the webinar has learned a lot. If anybody has more questions, you can also refer to the emails that Kim and Marilyn, the websites that they gave you, or you can send something to us and I will relay it. And finally, at this point, I want to say that I say a prayer for all of you. I know it's hard times. I wanted to tell you that here at the Covenant, we do keep everybody in our prayers when we meet. And I'll hopefully see you again. We do not have webinars in August, but we will be seeing you a lot in September because we have a lot planned for Season of Creation. So God bless each of you. Thank you, Kim, Marilyn, Ricardo.
Thank you.
Bye-bye.